Good afternoon, dear learners. I welcome you to NSC 523 Oncology Nursing. My name is Ilugbaru Deborah Oluwadamilola. I will be taking you through the course. I want you to sit down and watch, take your pen and paper and jot things you hear, and also we will admonish you to go to your LMS and pick up materials to read for your own understanding. I wish you best of luck. So, like I said, that this is Oncology Nursing, NSC 526, and it is a 2-unit course designed for nursing students of this university to have knowledge of cancers and be able to manage patients diagnosed with cancer. As we all know that cancer is a leading cause, or if not known, it is a leading cause of death and disability globally, which is impacting more than 14 million people each year. So cancers are reportedly affecting younger age groups now than before. So this requires a public health approach in nursing care. Learning outcomes. By the end of this course, you must be able to list the correct sequence of mitosis, explain the process of oncogenesis, identify common factors or common characteristics of solid tumors, describe and diagnose the staging of common tumors, enumerate the role of nurses in cancer care and treatment. We start with cell structure and physiology. Talking about cell structure, we all know with our knowledge of anatomy that the cell consists of 3 parts: the cell membrane, the nucleus, and between the two we have the cytoplasm. So this is a diagram of the cell that has been uploaded, that has been put here for you to study the diagram of the cell, the labelings, and so on. We are familiar with this in our knowledge of anatomy. So this is just to remind us. So talking about the physiology, we need to understand disease. We need to understand the disease process, and it requires knowledge of cellular function and dysfunction. So understanding disease requires knowledge of cellular function and dysfunction. Cellular physiology involves the close relationships between cellular components and activities, balancing control mechanisms to maintain constant conditions, and that is homeostasis, and also compensatory and repair mechanisms to minimize damage. So when we talk about physiology, it involves these 3 things: relationship between cellular components and activities, balancing, which is homeostasis, then compensatory and repair mechanisms. So also we are going to talk about this as regards all the parts of the cells. Talking about the plasma membranes, we look at the main functions as its membrane damage may lead to cellular dysfunction or death. So talking about the functions of plasma membranes, we see that if there is damage of membrane, then it may lead to cellular dysfunction or death. Also, the mitochondria, these are the main sites of energy production, and if there is a disorder in the energy production, then it will affect all cellular functions. And also talking about the nucleus, you know that the nucleus controls all the cellular activities, and when there is a problem in the nucleus, then there is a problem with the DNA. There will be damage to DNA, and there will be damage to the ionizing radiation. There are effective repair mechanisms, but severe damage usually leads to cell death or apoptosis. Then also there could be germ cell DNA damage, that is to spermatogonia or oocytes. Also we have somatic cell damage, and this acquired during life. Damage to stem cells is especially important in the development of cancer. So talking about the sequence of mitosis, we all know that mitosis is the process by which a cell replicates its chromosomes and then segregates them. That is, it is the process of cell duplication, and this cell duplication in which that one cell divides into two genetically identical daughter cells. So looking at this illustration that has been given, you discover that the cell mitosizes into prophase, prometaphase, then metaphase, anaphase, and telophase. And looking at this, you will see that that is how it will divide into daughter cells and it will continue to replicate. So that is the sequence of mitosis. So we move to process of oncogenesis. Talking about oncogenesis, it is the complex multi-step process by which normal cells turn into cancerous cells. So oncogenesis is the process by which a normal cell turns into cancerous cell. And oncogenesis can also be called tumorigenesis. That is the process whereby ordinary cells transform into cancerous cells. So oncology is the branch of medicine that focuses on the diagnosis, treatment, and management of cancer patients. And also the process of oncology typically involves several key from initial diagnosis to long-term follow-up and care. So what are the stages of oncogenesis? Like we have seen in the diagram below, we see that there will be initiation. That is, there will be an initiation of this problem, which is going to be promoted to to pro it is going to be promoted, and this is the promotion, and it will progress. The promotion, it will form the precancerous cells. The precancerous cells, and it progresses into the new cancerous cells, which is the which is the neoplastic cells, and also it goes to metastasis, whereas it goes to all the parts of the body, neighboring parts of the body. So the stages start from initiation, then it promotes to the pro-neoplastic cells, and also to the neoplastic cells, which are also the cancerous cells. Stages of oncogenesis, you can see that there is initiation, and this is when the cell undergoes a genetic mutation, and also the promotion, that is the mutated cell is stimulated to replicate rapidly, and we have the progression where the mutated cells invade surrounding tissues and metastasize. The tumor. A tumor is also known as neoplasm and is an abnormal growth of tissue that results from the uncontrolled division of cells. And also tumor can develop in any part of the body and vary in size, structure, and behavior. Some tumors are benign, which means non-cancerous, while others can be malignant, which is cancerous, posing a serious threat to the health by invading surrounding tissues and spreading to distant organs, and that is metastasis. What are the characteristics of tumors? We have the uncontrolled cell growth. Tumors, the growth can be uncontrolled. It grows rapidly, and the mechanisms of the growth divides so fast that it leads to cell proliferation. We have also the differentiation, and these are tumors that can be well differentiated. That is, it is resembling normal cells, or poorly differentiated when it is appearing abnormal and immature. So under differentiation, we have the well differentiated and we have the poor differentiation. Well differentiated, resembling normal cells; poorly differentiated, appearing abnormal and immature. Invasion is another characteristic. Tumors invade, and you see that they have the ability to invade nearby tissues and organs. And also we have metastasis. They can spread to other parts of the body through blood vessels or lymphatic systems. Another characteristic is angiogenesis. Tumors can stimulate the formation of neoplasm. It can stimulate the formation of the nearby tissues or vessels to supply them with oxygen and nutrients. What are the types of tumor that we have? We have the benign tumors. The benign tumors are the non-cancerous and generally do not spread to other parts of the body. And the examples are the fibroids, the lipomas, adenomas. They have slow growth, they are encapsulated, and they are non-invasive. That is the characteristics of benign tumors. Then we have the malignant tumors. These ones are cancerous, they are capable of invading nearby tissues, they metastasize to distant organs, and the characteristics is there is rapid growth, invasive, poorly differentiated, and often fatal without treatment. Examples are carcinomas, sarcomas, lymphomas. And we have the pre-malignant tumors. And these tumors are not yet cancerous, but have the potential to become cancerous. And this is, the example is dysplasia or carcinoma in situ. These are the types of tumor that has been illustrated in the diagram. You see the metastatic secondary tumor, how it is spreading fast. You see the cancerous one, that is the cancerous cells. This one that is spreading round is the cancerous cells. You have the lymph systems, as it can help in the spreading of the cancerous cell to metastasize to other parts of the body. That is the illustration. Then we have the stages of tumor. What are the stages of tumor? We have stage 0, 1, 2, 3, 4. Under stage 0, it means that cancer cells found their earliest form. This is when there is initiation. Stage 1 is a small tumor that hasn't spread. Then stage 2 is cancer that has grown more deeply into nearby tissue. Then we have stage 3, which is cancer that has spread to lymph nodes or nearby tissues. Then stage 4, we have cancer which has spread to distant organs. And that is the stages of tumor. Then we move to heart tumor. This is a firm, solid mass that can be either benign or malignant, as we have been saying. And the hardness is often due to the dense cell growth or fibrous tissue. These tumors are typically firm to touch and may have irregular wedges. Examples include the breast cancer, osteosarcoma, lymphoma, fibrosarcoma, which is the cancer of the connective tissue. What are the nursing responsibilities in care and treatment of tumors? Nurses play a crucial role in the care and treatment of patients generally. So in tumors too, they have special role to play. The first thing is assessment and monitoring. There must be an initial and ongoing assessment of patient physical, emotional, and psychosocial status. Also, there must be administration of treatment, administering chemotherapy, immunotherapy, and other cancer treatment. And also, there must be symptom management. In cancer, it is believed that you treat according to symptoms. So, when there is pain, you treat. When there is fatigue, you treat. When there is nausea, you treat. And providing palliative care to patients with advanced stage cancer is very important in taking note of the symptom management. So you focus on improving the quantity and the quality and reducing suffering of that individual. Also, you give patient education, educate the patient, the families on the disease process, the treatment options, the side effects, and so on. Then you talk on self-care, nutrition, physical activity, and coping mechanism during the treatment. Emotional and psychosocial support is very important as the nurse. So you encourage the families to give psychosocial and emotional support. You address fears and anxiety, and you prevent depression through counseling and by connecting patients with other mental health professionals or support groups. Also, collaboration and coordination. You collaborate with oncologists, surgeons, and radiation therapists to create a comprehensive treatment plan for this patient. Palliative and end of life care too is very important in the nursing responsibility. Then advocacy and communication. You communicate with other care teams and you advocate for your patients with other care teams. So far so good. We have been able to talk about oncology, the cell structure, process of cell mitosis, then the oncology, the beginning of oncogenesis, how cancer develops, and so on. The nursing management too has been touched. I wish you best of luck. See you next class. Thank you.